Okay, so this is our slides on depression and suicide, and we're the kangaroos. So, overview of what we'll talk about. First, we'll go into the statistics of both subjects. We'll talk about symptoms and warning signs, and then we'll go into the prevention and what not to do and what to do in those situations. So, the first thing we'll talk about is major depressive disorder. In major depressive disorder, or MDD, an individual experiences a major depressive episode and depressed characteristics such as lethargy and hopelessness for at least 2 weeks or longer, and daily functioning can become impaired. The book states that 15 to 20% of adolescents experience a major depressive disorder, and recently a study in China indicated that since COVID-19 in effect, adolescents are more prone to becoming depressed due to many adolescents not being able to do normal everyday activities they would do every day but can't and wasn't able to during the COVID-19 outbreak. The book also states that females are far more likely to develop major depressive disorder than their male counterparts due to the self-image or outlook males and females have at the adolescent age. Boys are supposed to keep their feelings and emotions in and be strong and tough guys, where girls are known for expressing their emotions and how they feel. So next is persistent depressive disorder. In persistent depressive disorder, people may experience depressed characteristics for most days for at least 2 years. This may lead to symptoms of suicidal ideation. Often goes undiagnosed in adolescence because behavior may seem normal. Criteria of depression may manifest itself differently among different adolescents. By age 15, females have higher rates of persistent depressive disorder, that is twice of that of their male counterparts. This can be correlated to the difference in the self-image or outlook males and females have in their adolescent age. Girls are known for expressing their emotions and how they feel, but boys are expected to hold their thoughts and emotions in and be the strong and brave stereotypical guy.
So next we have the symptoms and warning signs. So the first one is depressed mood most of the day. So seeing if the person's very disconnected and not interacting with people the way they did before. Reduced interest or pleasure in all or most activities. So you're asking yourself, is this person spending less time participating in the things they're passionate about? If they enjoy going out and playing basketball, are they still keeping up on practicing their layups or making an effort to go out and play with their friends? The third is significant weight loss or weight gain or significant decrease or increase in appetite. So are you noticing any changes in their diet or body image? With this example, it can also correlate with eating disorders, which can be another warning sign of depressive ideations. Next is trouble sleeping or sleeping too much. So have you noticed a change in their sleep schedule? And then psychomotor agitation or retardation. Are there any new or concerning mannerisms? Are they acting out of character and being more agitated with small things that wouldn't bother them before? Next is fatigue or loss of energy. So is this person as active as they were in the past? Are they still making as much of an effort to do the things that they like? Do they have the energy to do the things that they like? Are they making an effort to make sure they're not dragging the group down if they're out with other people? Next is feeling worthless or guilty in an excessive or inappropriate manner. So has this person changed the way they speak about themselves? You can hear words like, I'm the issue, I'm not worthy of being part of this group, things like that. Next is problems in thinking, concentrating, or making decisions. So is this person struggling with coming to a resolution? If they're told to decide what to eat, are they struggling and just decide not to have anything at all? If they are trying to get out of bed and make it to their class, are they able to put on clothes other than the ones that they slept in? And then lastly is reoccurrent thoughts of death and suicide. So has this person said anything to make you concerned with your safety? This is more direct in regards to them blatantly saying like they want to end their lives.
All right. So suicide is considered a symptom of depressive disorder. It's usually sort of an end result. And according to the book, suicidal behavior is rare in childhood but escalates in adolescence and then increases further in emerging adulthood. And suicidal behavior is rare in childhood but escalates in adolescence and then increases further in emerging adulthood. The book also states, also in a recent study, in 32 of 38 countries, early sexual intercourse, which is around the age of 12 to 15 years old, was linked to increased suicide attempts, and having sexual intercourse with multiple partners increased the risk of suicide attempts further, as quoted by Smith and others, 2020. This means that when adolescents are having sexual intercourse with many different individuals, the risk and attempts increase dramatically. Now, there is a thing called a suicide cluster, which is when one adolescent commits suicide and other individuals, usually friends or peers, find out about it and then they too commit suicide. This stat is occurring more and more nowadays because of social media and widespread information spreading these awful stories. Although there is more awareness and spread of why suicide is bad, but those who suffer from depression and don't talk to others about this can become more at risk to committing suicide now, knowing that others did it, and it can provide a false sense of belonging. If an adolescent has recently or currently is experiencing stressful circumstances, for example, poor grades, a recent breakup, family issues, these may trigger a suicide attempt. It is known that females are more likely to attempt suicide than males. However, males are more likely to be successful in their attempts. This is also due to the fact that males are more likely to use a lethal mean, for example, gun, than females, which typically results with cutting wrists or overdosing on sleep medication. Some factors that may be involved in suicidal ideation may include that family instability, self-esteem issues, peer relations, and many others.
Next, we're going to move on to prevention and what to do. Ask direct, straightforward questions in a calm manner. Are you thinking about hurting yourself? Assess the seriousness of the suicide intent by asking questions about feelings, important relationships, who else the person has talked with, and the amount of thought given to the means to be used. If a gun, pills, a rope, or other means have been obtained and a precise plan has been developed, clearly the situation is dangerous. Stay with the person until help arrives. Be a good listener and be very supportive without being falsely reassuring. Try to persuade the person to obtain professional help and assist him or her in getting this help. Seek support for yourself in the situation as well. What not to do. Do not ignore the warning signs. Do not refuse to talk about suicide if a person approaches you about it. Do not react with humor, disapproval, or repulsion. Do not give false reassurance by saying such things as, everything's going to be okay. Also, do not give out simple answers or platitudes such as, you have everything to be thankful for. Do not abandon the individual after the crisis has passed or after professional help has commenced.